This contact over. Where's this guy?
Where you were? With the frontal, you mean?
Yeah.
My house was this way.
Got the ethmoid on backwards. I'll give you that.
Look at what makes the skull for this people. Oh, is that what it is?
Okay, so you're going to apply pressure here.
Right here.
If you apply pressure here and you push up, you're going to drive this into here. That's going to cause the frontal to do that. And that's what you want to do. Okay.
Now that makes sense. That makes sense.
And at the meantime, and if you're doing that to it, what's going to happen in the back, it's going to externally flare. Now, if your other hand happens to also be over, let's say you did it this way, right? Then if you are behind, like here, if you press down, you're going to cause the parietals to lock up into here. But if you take a contact anterior to the coronal, then you can disengage it from the parietal. See, because it's overlapped there. You see how it? See the shelf?
Right, so I'm gonna go right here.
Yeah, you don't want to be.
That's how I do frontal sutral.
Okay, but if you're trying to bring it in, if you're trying to bring it into an external flare, okay, then if you apply pressure here, you can disengage it from the parietal, but you're actually holding it into an internal. If you have contact back here and just stabilize on the parietal, okay, then the sphenoid will actually, as you're doing the movement down here in the maxilla, because it's attached to this greater wing of the sphenoid over here with the zygomatic, the zygomatic bone. By working the maxilla through the palatine into the pterygoid is going to cause the sphenoid to flare external if you push back. Following me? Okay. So this hand, you can have your thumb on the greater wing of the sphenoid on this side. Okay? Stabilize the sphenoid over here, and this one over here, you can basically, well, I guess you could kind of hold the frontal a bit to help disengage it a bit from the parietal, but if you apply your pressure, you're working through the maxilla, that will then move the sphenoid, its greater wing, which will affect the maxillary frontal, the zygomatic frontal process. And it'll also affect the greater wing of the sphenoid along its lateral anterior aspect. So the greater wing of the sphenoid will be the driving force.
Do you want a zygomatic?
Let's get rid of the ethmoid for a minute. A Waldo ethmoid.
Don't crunch the paper thinness of it.
I don't see the magnet for attaching this. Oh, there it is.
Yep, it's there.
So you can see here, now you see this back part right here?
Yeah.
That's what the greater wing of the sphenoid attaches to.
Right.
Right? And so you've got this coming up into here, and you're not going to be able to disengage this because you've got a lot of interlocking dentate structures, which I'm going to show you. Okay? So you can use, if you work with the maxilla through the zygomatic is going to affect the frontal here, right? Okay. So, if you work through the zygomatic, you can affect the zygomatic to the maxilla and to the frontal and the greater wing of the sphenoid.
Right.
And also, if you're pushing up on this, the effect it's going to have on the greater wing of the sphenoid is going to help to flare this greater wing of the sphenoid this way, which is going to take the zygomatic into external rotation, which is going to pull the frontal into external. You're starting to get the image?
Yeah. So this is the internal frontal. I want to push up to get that right here. I'm going to get it to flex this way.
Yeah. Just
And
think
this
of
I'm going to rock and bring it out external that way.
Make your image from this perspective, okay? Everything you're dealing with to get the frontal to go external, the frontal's external rotation is always going to be in this plane in the posterior. So the frontal itself is doing basically, let's see if I can show this to you. Okay. This portion is going inward or internally rotating on itself, while the back end is expanding out this way. So as this goes this way, this is going this way, right? So if you keep that image in your head, then everything that you do in the direction that you pull things, like the zygomatic, if I want to rotate this and create a force that's going to close it up, I'm going to rotate basically on the zygomatic bone in a direction that's going to tuck it this way. If I want to flare it out, don't look at me, look at this. If I want to flare it out, then I'm going to try to pull it out this way because that's going to pull the back end out. If I can create this to tuck in, causing the sphenoid to actually go into an inhalation phase, as the sphenoid goes into its inhalation phase or flexion, this greater wing of sphenoid is going to rock like this, but it's also going to flare out like this. And that's going to pull that out. So I want to do whatever I can to create a strain into the spheno-basal junction to create a trabecular stress pattern that's going to want to move the sphenoid into its inhalation phase, which is like this, which is going to be the posterior force along with the zygomatic attachment that's going to pull this out. Get the idea? So whatever you're going to do, you have to keep that image in the back of your mind. Watch the animations when I show them in the beginning and you'll see it. Does that kind of help?
Tell him you should pick the occipital something.
No, I did this because it's difficult. It's never taught, and there's no consensus on it. And that's why I called Mark and I go, "We got to help me on this." And
I
figure out
wish
what's
you would have told me. We could have spent all last night going through this to just.
Well, I'm tired, but we were having too much fun.
And you've heard it here.